resurgence of COVID-19 cases affecting many parts of the country is concerning.
With cases rising, there continue to be questions about where exactly the virus is spreading. Take a look at this graph from federal government data earlier this month. We've taken out the two biggest categories, long-term care homes and healthcare. Of the remainder, the two settings with the highest number of cases reported are what's called industrial. That includes manufacturing facilities and workers' living quarters, as well as congregate living facilities. Those are shelters and group homes, for example. So not a lot of data that gives us specifics on the risks of our day-to-day activities, such as eating in a restaurant, going to work, or going to the gym. So we're going to bring in a couple of doctors to help us assess that risk. And joining us are infectious disease specialist Dr. Suman Chakrabarty and Dr. Susie Hoda. Welcome to both of you.
Thank you.
Thank you.
We know people are constantly having to make their own judgments about risk tolerance. We asked people to send in questions, and here's our first one.
I'd like to know more about super spreader locations, how those places are determined, and what's the overall risk.
Dr. Chakrabarty, let me start with you and explain for us what super spreader means.
Yeah, this is a very important concept. So super spreader, it generally refers to a situation where you have one or a few number of people who are able to infect a large number of people. So to give an example, a classic one was in Washington State, where you had that choir where there's 3 or 4 infected people, and they managed to infect 30 or 40 people in that choir in one setting. And these patchy super spreader events is what we think is the way that the outbreak has been propagating over the past several months. And it's really important to realize that, and interventions can be directed to try to stop that in its tracks.
So a lot was made of singing inside a small area with that Washington State case, but is there anything more we should know about potential super spreading events?
Yeah, the general theme of things is that we're seeing this as a repetitive thing, that it's indoors in an enclosed environment, multiple people present, and they're there for a prolonged period of time in sorts of agitated states of, like say, talking, yelling, singing, and even crying. All of these things can result in droplet formation, and this is what results in the spread of the virus. And this is what we've seen in the evidence that's coming from all around the world in the global experience.
And Dr. Hoda, I'd like you to jump in and give us a bit more guidance in terms of, as we're trying to figure out where we're less safe and more safe, what would you tell us?
Well, I think, the epidemiology really points to close contact with individuals who are infected as being one of the most important things. So, where we're seeing outbreaks, it tends to be either workplaces or in bars or other settings where you get lots of people who could be close together. And, the behaviors are also important in terms of spread of disease. So what are they doing when they're there together? Are they yelling? Are they, exercising in gyms, for example, where you get a lot of heavy breathing? And then, of course, what's the environment like? So what's the ventilation like? Is it really tight and sealed? Do you get a lot of fresh air in? That would be helpful. Those kinds of factors are really what drives it. And what we're seeing epidemiologically is relevant for spread.
And Dr. Hoda, may I ask you, when you're out and about, let's say going into stores or walking outside from store to store, to what extent do you feel at risk in those situations?
I think that the thing about stores is usually you're in there pretty transiently. So there's a time-dependent factor as well. So if you're going to be in some indoor setting for a short period of time, putting on a mask, and if everyone else around you is masked as well, that's an important factor to protect you, and limit the amount of time that you're in that setting. And I think that's a reasonable sort of outing where your risk is not quite as high as if you were in, a party, for example, for a long period of time.
Let's get to another video question now.
Why did we take such great measures at the beginning of the pandemic to lock down everything when transmission rates were lower to where we are now, where transmission rates are higher, but we're allowed to go out and do activities which were regarded as unsafe at the beginning?
I'm going to put a portion of that question to each of you. First of all, Dr. Chakrabarty, are transmission rates higher now than they were at the beginning?
Not necessarily. So one of the things that's very important is back at the beginning in spring, we were only seeing the tip of the iceberg of the cases in terms of our testing. So say something that was like, 500 cases a day was probably more like 2,000. We just weren't picking it up. Now with our better testing capability, we see the rest of the iceberg, and the numbers seem higher, but it's a different situation than it was in March. And for that reason, it's important that we know more about the virus, we know where the high-risk areas are at, and we can target our interventions rather than do a blanket lockdown that we had to do back in March.
Which leads me to the last question to you, Dr. Hoda. We have only about 30 seconds, but why aren't we tightening more? Why don't we have more of a lockdown since numbers seem so high?
Well, the real key is the healthcare system being overwhelmed by what we're seeing? And right now, it's not. We're coping with the number of cases that we're seeing that are severe enough that they need to have healthcare interventions. Back in the earlier stages, we were starting to see a more rapid rise in hospitalizations, and we were quite worried because we heard about what was happening in Italy and New York, for example, where things happened quite rapidly and it was unpredictable and the system got overwhelmed. And that was a rationale for proactively shutting things down a lot quicker.
And I'm sure you'd both endorse this message. We should keep our guard up, stay vigilant. Thank you both very much for speaking with us this evening.
You're welcome.
Thanks for having us.
And we're always looking for your questions about COVID-19, so send them in. You can message us directly on Instagram @CBC The National or email us at covid@cbc.ca.